Hello there, and welcome to the Medicare Made Easy video library. The focus of this lesson will be to take a closer look at Medicare Part C, otherwise known as Medicare Advantage plans. In other video lessons, we refer to two possible options or paths people can take as they transition to Medicare. Joining a Medicare Advantage plan is one of these options. These plans should not necessarily be looked at as being better or worse than the option of staying with original Medicare. Instead, it is simply a different way to get your healthcare coverage. Advantage plans are offered by private insurance companies that have been approved by Medicare. These companies must follow the rules that Medicare sets with regards to the coverage provided. All Medicare Advantage plans can be counted on to cover exactly the same services that are covered under Medicare Parts A and B. And many plans also provide additional services as well. For example, many provide routine vision services, such as annual eye examinations and screenings, as well as routine dental services and additional benefits not provided by Medicare. Regardless of the plan you might join, you will still be required to pay your Medicare Part B premium, and you may also have to pay a monthly premium for the Advantage plan itself. Depending on the plan you select, there could be additional out-of-pocket expenses that you might face when you receive your healthcare. Plans are free to structure these out-of-pocket expenses differently. All Advantage plans will have an annual limit that will effectively cap your total out-of-pocket costs for medical services every year. The amount of the cap can be different depending on the plan. If you reach this cap anytime during the year, you won't pay anything more for covered services for the balance of that year. There are several different types of Advantage plans. This video will focus only on HMO and PPO plans. The network of doctors and care providers that you have access to will vary greatly depending on the type of plan you might select. And all healthcare providers have the option of leaving a plan at any time. If your primary doctor leaves the plan you join, you will need to choose another doctor in that plan's network. If you decide not to join an Advantage plan and instead stay with original Medicare, your network of care providers will be the largest. You can go see any doctor of your choosing, as long as that doctor accepts Medicare. The same is true for any other care providers. As long as they accept Medicare, you are eligible to use them. This is different if you decide to join a Medicare Advantage plan. With most HMO Advantage plans, you can only go to the doctors and other healthcare providers that are in the plan's network, except in an urgent or emergency situation. In most cases, you need to get a referral from your primary doctor before you can see a specialist in HMO Advantage plans. With PPO Advantage plans, you typically have the option of going outside that plan's network to get care, but you pay less if you use healthcare providers that are part of that plan's network. Most Medicare Advantage plans will also come with an embedded prescription drug plan. This will allow you to get your medications through that plan's network of pharmacies. As with all prescription drug plans, there will be copays and perhaps deductibles that will be your responsibility to pay out of your own pocket. If you decide to join an Advantage plan, you cannot purchase a Medigap supplement insurance policy. Insurance companies are strictly prohibited from selling Medigap plans to people who are in Medicare Advantage plans. That's it for this overview of Part C Medicare Advantage plans. Check out the other video lessons in this library dealing with Medicare Parts A and B, Medigap plans, Part C Advantage plans, Part D drug plans, and an entire range of subjects designed to help you achieve the retirement with dignity and peace of mind you deserve. Thanks for watching. See you in another lesson.